following reduce the secretion of the renin. Renin is a hormone. It is released from the juxtaglomerular cell of the kidney, but when the secretion is reduced, the options are erect posture, adrenaline, hyponatremia, hypotension, and beta blocker. So now we have to find out a option which is responsible for reduction of secretion of the renin. So first of all, let's see in short about the renin. Renin is secreted from the juxtaglomerular cell of the kidney, and it hydrolyzes the angiotensinogen to produce angiotensin 1. And this angiotensin 1 later converted into angiotensin 2, and this angiotensin 2 also responsible for secretion of aldosterone, and finally there is renin angiotensin aldosterone system activated. But some factor which increase the secretion of the renin, first of all, the hypotension. So when there is the hypotension, it causes reduced renal perfusion. That means when there is hypertension or reduced blood pressure, the blood pressure of the kidney tubule or blood pressure of the artery of the kidney will reduce, and it will activate the juxtaglomerular cell, and there is secretion of the renin. Then hyponatremia, that means sodium level reduce. We know that the sodium, it is directly related to the blood pressure. When sodium reduce, blood pressure reduce. When sodium increase, blood pressure increase. Also the sympathetic nervous system stimulation. The sympathetic nervous system stimulation, it occurs in the emergency situation or where there is decreased blood pressure. So when there is decreased blood pressure or emergency condition, then adrenaline and noradrenaline or epinephrine and norepinephrine, they are released, and they act on juxtaglomerular cell and causes the secretion of the renin. The catecholamine, they are the product of the sympathetic nervous system stimulation. That means the adrenaline and noradrenaline, or epinephrine or norepinephrine. Also the erect posture. In case of the erect posture, there also the renin secretion occurs. But some factor also that reduces renin secretion, just opposite. That means when there is hypertension, when there is hypernatremia, when there is parasympathetic nervous system stimulation, where there is decreased secretion of epinephrine, norepinephrine, and lying posture, in this condition renin secretion reduce. Some factors that also reduce, or some drug that also reduce the secretion of the renin, one of them is the beta blocker. The beta blocker, because the beta receptor is present in the kidney, so when beta blocker is given, this beta blocker, it blocks the juxtaglomerular cell, and it reduces the secretion of the renin by the kidney. Also the NSAID is another drug which reduce the secretion of the renin. And this flowchart, it showing the function of the renin. So when there is the blood pressure reduce, in this condition blood pressure also reduce in the blood vessel of the kidney, and it reduce and it secretes the renin, and renin acts on angiotensin 1, and it converts the angiotensinogen into angiotensin 1. Then angiotensin 1, when it goes to the lungs, here the angiotensin converting enzyme, and it converts angiotensin 1 into angiotensin 2. This angiotensin 2, it acting directly on the blood vessel, causes vasoconstriction. It acts on the adrenal cortex and release of the aldosterone, and this aldosterone causes sodium chloride and water reabsorption from the kidney tubule. And also this angiotensin 2, it goes to the brain and acts on the hypothalamus, and it induce drinking water and also increase the secretion of ADAs from the posterior pituitary. And this whole system is known as the RAS system. That means renin, angiotensin, aldosterone, and sometimes ADAs. So which one reduce the secretion of the renin? It is the beta blocker. So the beta blocker, it reduces the secretion of the renin. Also another drug which is the NSAID. NSAID also reduce the secretion of the renin. But erect posture increase the renin. Adrenaline, which is the sympathetic nervous system stimulation, it also increase secretion of the renin. Hyponatremia, that means when decrease sodium, decrease blood pressure. So when there is reduction of the blood pressure, it also increase secretion of the renin. And hypotension also, it causes secretion of the renin. Thank you all.